that, a cow? Moo moo. And what's that? That's a sheep. We've got a 17-month-old granddaughter, Riley. She's kind of this incredible little girl. She's a thrill to be around. We babysit her a couple mornings a week. There's also a baby boy that's on the way. You know, it's nice to feel good and be alive and have the ability to participate in the early stages of a grandchild's life.
I met John the first time briefly actually in the hospital and then subsequently in the clinic. John's diagnosis is called amyloidosis, and it's a blood cancer. So there are cells in the bone marrow, they're called plasma cells. Those are the cells that make this bad sticky protein. And they can stick in many organs of the body and damage things like his kidneys, your heart, your liver. And so in John, primarily the affected organs in his body were his liver and then part of his nervous system that actually controls his blood pressure.
When I'd get up, my blood pressure would drop significantly, and that would cause lightheadedness and general weakness. Lost 35, 40 pounds. I had difficulty staying awake throughout the day, and it just seemed to kind of start to accelerate. The worst thing during the process is something's wrong, but nobody can identify what in the world it is.
Because this disease, even though it's a blood cancer, it can impact any organ in the body. Often patients end up in a cardiology clinic or in a kidney clinic or in a liver clinic. So one big effort we've done here at Loyola is we do a lot of lectures and outreach, just making sure that our providers understand those early signs and symptoms.
The great things about the Loyola system was there was only 6 days that passed between when I got the definitive diagnosis and I saw Dr. Hagen for the first time.
So the treatment for amyloidosis is really geared around therapies that kill those cancer cells in the bone marrow, those plasma cells. It's like we got to turn off the sink. Until we turn off the sink, kill those cancer cells, they keep making those bad proteins which circulate in the blood and continue to negatively impact his organs.
After the initial 24 weeks of chemo, there was an additional 15 months of maintenance therapy.
And then ultimately, after those 24 weeks of initial kind of more intensive therapy, John was able to get into a good remission and then was able to transition to kind of a more simplified monthly treatment, which we were able to do for him and get his cancer under good control, thankfully.
It's kind of a godsend. So I mean, it's like, a lot of cancer treatments incredibly enhance the ability to people survive and have a quality of life in the aftermath.
When I think back about some of those early clinics with John, when he was in the clinic and he literally was in our exam bed and couldn't sit up for me to even examine him. And now when I see him in clinic, he's walking without even the assistance of a cane, he's playing with his grandkids, he's active, went back to being able to work full time, really living his life as if he didn't have the cancer. It's really rewarding to see, particularly for a disease that is truly life-threatening.